Okay, great, Tom. Thank you. All right, good afternoon, everyone. This is Keisha, and want to welcome all of you to today's PAPRN Plus call. We are really excited to be here today and excited for our speakers, and want to just begin by welcoming anybody who's in the network and saying hello again to all of you we haven't spoken to since the summertime. So I hope everybody's doing well and enjoying the fall. It's been pretty hot in Baltimore. It's our first day in the 70s, so it's really lovely out. Just wanted to begin, as we usually do, with our CDC updates, and then we'll do a few brief coordinating center updates before turning to our presenters, who we're really excited about. So let me pause and ask Tom to provide any updates from CDC.
Yeah, first I'd like to just make sure that people that were expecting notice of awards have gotten them. If you haven't, you've got about 1 day left, but I'm pretty sure everybody's received confirmation for their PAPRN awards. Also, Jamie Shariki is just walking out the door right now from having done a presentation on some of her PAPRN work and some of her other work, especially the stuff around Google Earth and around complete streets and zoning. It was very well received here, and so I think we probably mentioned PAPRN 25 times in the talk, so it's moving its way through the ethos around here. So that was a very positive session. And then just to some time ago, I mentioned to people that we were going to try to build on the dissemination implementation work that PAPRN had been doing and had the workshop on, and we're going to go to NCORE to build on that. We're shifting the focus a little bit. Instead of calling it dissemination and implementation, we're going to have an umbrella around rural and youth physical activity, and recognize that a lot of that work is really not ready for dissemination and implementation in the formal sense, but try to just get more of a landscape of what's out there and what needs to be done to promote physical activity programs in rural areas for youth. Anybody that's on either the rural work group or any of the other work groups are welcome to join this effort. And basically what we do is have a small proposal to NCORE that would probably then result in in-person meeting of people coming up with a research agenda. So if you're interested in that topic, let me know, and I'll combine a bunch of people and we can move further on that. That's what I have from the CDC side.
Great, thank you, Tom. Just to your last point, do you have a deadline for when you want people to get to you? I assume it's possible.
Yeah, before you forget.
All right, sounds good. Thank you. Does anybody have any questions for Tom? Okay, well, hearing none and seeing none on the chat, let me just briefly mention a couple of things from the coordinating center. Actually, I'll begin by mentioning, so APHA is coming up, and we sent out a few emails asking around what would be the best time for people to get together socially if they were interested. And it's looking like Sunday evening. We're sort of going back and forth on the time, but I want to ask all of you to look out for an email that mentions a social event. We're trying to avoid conflict with the physical activity section awards that evening, but we're trying to find a time where we can get together just socially to say hello and for us to connect. There is a PAPRN Plus session on the Monday of AP. Oh no, actually Tom's moderating, and I actually cannot remember when your session is, Tom. And forgive me for that. I just forgot. Tom, if you know, let me know. Otherwise, we'll certainly email that out, and that will be a time to highlight the research from the collaborating centers that are supported through PAPRN Plus. Just another point, there will be an opportunity for those of us involved in PAPRN Plus who are going to ALR to get together. We are going to support some members of the working groups and the collaborating centers and trying to see how much we have for that. But we're really grateful that the CDC allowed us to use some of the carryover to support what is ALR and actually up in Canada this year in early 2018. So that's a good segue to Amanda to see if you have anything to add about the ALR gathering. Sure,
ALR. I'm happy.
Yeah, thanks.
Sure. Yes, so I just wanted to report back. We received actually a record number of abstracts this year. So we got over 450 abstracts, and those have all just completed review this past Friday. And so the selections are being made over the next few weeks. And for anyone who submitted an abstract, you should receive your notification by October 13th. And as Keisha said, we will be coordinating at least one gathering, possibly more, at the ALR conference. So if you have any ideas, I know what we've done in the past has seemed to be successful, but if you have any ideas for how we can best use a little bit of in-person time together, please let us know.
Great, thank you, Amanda. And let me see if there are any questions for Amanda or myself.
Thank you.
Okay, great. So I will transition now and introduce our speakers so we can go ahead with our presentation. But let me remind everybody to please mute your phone unless you're speaking so we can avoid background noise. So I'm thrilled that we have two fantastic speakers who will be with us today talking about translating research for policymakers and advocates. And I will introduce Alexandra Morshed and Dr. Rachel Tabak, who are both with the Prevention Research Center at Washington University in St. Louis. Alexandra Morshed is a doctoral student where she's affiliated with the PRC, and her research focuses on the intersection of obesity prevention, translation of evidence into policy and practice, and systems science methods. She has a wealth of experience translating science, translational science projects, which include research on how best to disseminate evidence to policymakers, advocates, and public health practitioners, as well as efforts to increase translational research capacity amongst investigators at her institution. She earned a Master's of Science degree from the Netherlands, where she specialized in nutritional epidemiology. And Dr. Rachel Tabak is part of the ERC, as I mentioned, and she works in obesity prevention and community-based physical activity and nutrition strategies. She's also interested in dissemination and implementation research. Dr. Tabak is involved in research examining interventions to promote healthy nutrition and activity behaviors in families, really particularly in the home environment. She's also been involved in work evaluating effective worksite policies, environments, and worker health behaviors. She examines how stakeholders, including researchers, advocates, and policymakers, affect how research evidence is transformed into programs and policies. I want to thank Alex and Rachel for making time to be on this call today. This is a topic that we heard from many of you that you wanted to have featured in a session, so we invited them to be here today, and thanks to Jamie Shariki, who had suggested them. And I'll turn it over to Alex and Rachel.
Sounds good. We're just unmuting here. Okay, and loading up our slides. Okay, can everybody hear us okay?
Yeah,
sounds good. My name is Alex Morshed, and I'm, maybe just do this. And I'm excited to be here today. As introduced, I am at the Prevention Research Center at the Brown School at WashU, and before that, I was at the Prevention Research Center at University of New Mexico. So I'm really happy to be presenting to all of you today, to this audience, and yeah, we can get started.
Sure, and this is Rachel Tabak. I'm also excited to be talking about this. So I'm with Alex here at the PRC in St. Louis, and before that, I was at the PRC at UNC Chapel Hill. So this is an exciting audience to talk to.
So before we get started, we just want to share the source of the funding that for the specific studies that Rachel and I will be talking about, and it comes from NCI and IDDK and from internal funding at Washington University. And to begin with, we wanted to start with an overview of policy dissemination research. Most of you are probably familiar with most of these points, but just to give us all a baseline. And a lot of this content comes from the chapter by Jonathan Pirtle, Beth Dodson, and Ross Brownson in the Dissemination and Implementation Research in Health book that will have a new edition soon in 2018. And so policy dissemination research is defined as the study of targeted distribution of scientific evidence to policymakers to understand how to promote the adoption and sustainment of evidence-based policies. And so for those of you who work with Canadian, UK, and Australian contexts, you'll know that sometimes it's referred to as knowledge transfer or knowledge exchange, and there's a good amount written about disseminating to policymakers. And generally, this research focuses on the big P policies, so laws, regulations, and to date, the existing body of research consists of two major categories. One is so-called audience studies, which tend to be formative, often cross-sectional. They assess policymakers' knowledge and attitudes about research evidence, their practices, their preferences for receiving this kind of evidence, and the policymaking context, often including political and social factors. And then there can be intervention studies, so studies that test specific dissemination strategies to see whether they affect shorter and longer term outcomes, such as use of evidence in policy making, or further down the line, enacting an evidence-based policy. As we know, I think this is similar to policy research in general. This field, these questions do not lend themselves well to randomized controlled trials and other designs that are considered gold standard. And we often depend on natural experiment, and we have to be quite opportunistic. And so this means that when we're thinking about evidence-based policy, we have to redefine the evidence a bit to allow for designs that are not considered as strong. And sometimes some other challenges that we encounter when doing this research is response rates with policymakers as well as advocates. But on the other hand, since we know this also from policy research, a lot of the information about the policymaking process and its outcomes is publicly available. Sampling frames are easily accessible for sampling of legislators, and so there are certain parts of this research that make it a little easier. And so to explain, why we are interested in the research questions that we are asking today, we know that policy is important for chronic disease prevention and control, for obesity prevention, physical activity, and nutrition. We know that 80% of US deaths are caused by chronic diseases, and about 1/4 of these are due to cancer, for example. And the CDC estimates that 1/5 of deaths from cancer are potentially preventable. But we know that policy translation gaps exist. And we also know, and now I'm drawing on the multiple streams framework, so the kingdoms framework, and specifically about the policy stream in that framework where policy solutions compete for acceptance. We know that when we're working in that stream, that different policy actors have different needs around how research is framed and how it's shared with them, and how they're able to use it. And so as these actors in this stream make decisions, we're interested in how they use and seek information, including research information, and how they prefer this research information to come to them. And we know there's some shared preferences, especially among people who are from the same institutions. We know that differences will have an impact. And so we wanted to look at policymakers and specifically legislators, but a group that is currently under-examined in research is advocates and the role of advocacy organizations, even though they're an important actor in policymaking and potentially evidence-based policymaking. And yeah, I'll hand it off to Rachel.
Thanks. So to kind of address those questions, we used a study to ask 4 different questions. One of those looking at differences between preferences for research framing, information use, and then the perceived reliability of sources of evidence between legislators and advocates. Then we wanted to look at what is useful to advocates as they work with policymakers. We also wanted to look at legislator preferences and whether those differed by their subject area in terms of the policy they work on. And also disseminating research through legislative testimonies and what role that could play in bringing evidence into policy. And so we did that through 2 different cross-sectional studies where the first one we asked, and we actually called on the phone and talked with 862 state legislators from state houses and senates who were randomly sampled from the available 7,525 state legislators from all 50 states, Puerto Rico, Guam, and the U.S. Virgin Islands to represent the whole United States. From those 265 were identified as working mainly around health issues related to cancer, obesity, diet, nutrition, physical activity, or tobacco. And another 125 who were specifically in working around behavioral health issues. And in the second group, we talked with 77 state-level advocates who were identified through different Google searches that were state-specific around advocacy groups, and also those specifically that were groups related to cancer, obesity, nutrition, and physical activity. I think we mentioned at the very beginning this was funded by the National Cancer Institute. Was one of the funders, and that's why the focus on cancer. So again, we talked to these stakeholders on the phone. We asked them a series of questions using quantitative surveys, questions asking about information seeking and utilization of information, their preferences around research framing, and then their preference around the reliability of information that they received from different sources. And all of those were asked on a rating of 1 to 5. We adapted these from a previously developed measure by, I'm going to say this wrong, but
Bogenschneider.
Book that we have kind of a Bible here, and that we validated in a sample of state legislators using cognitive testing to make sure that the questions would be understandable to that audience, and also with representatives from the advocate sample. We also had some open-ended questions specific to each audience. So for the advocates, we asked questions to capture aspects of research evidence and how they use that evidence in advocacy. And for the legislators, we also asked open-ended questions asking about the influence of legislative testimony on their policy decisions.
Okay, and so we'll first talk about a couple of studies that Rachel and I were directly involved with. And so one of them compared legislators and advocates. And so to be able to compare our legislators to the advocates, we used those legislators who were working on cancer or obesity, physical activity, diet, or smoking. And we see this is a descriptive table of the 2 groups, and we see that the 2 groups are really different. The advocates tend to be more female, younger, have more education, more liberal, more beautiful, just kidding, and generally have a longer tenure in their jobs, which may be understandable. So we're looking at 2 different groups and we're interested in how we would share information with them and what their preferences are for how that information is framed. And so this is coming from the Morshid et al. Paper, and that is cited at the end of this presentation. And so we found that advocates overall use and seek information more often than legislators, except for that legislators tend to use the legislative research bureaus more often. For research framing, there are some themes that are common to both groups, and to some extent, these themes are not surprising knowing what we already know from studies with policymakers. Both groups value and use research evidence in their work, though neither really contacts researchers for advice. And both groups prefer research information that is understandable, concise, relevant, actionable, timely, includes cost-effective data. So easy, right? For legislators specifically, dissemination, so if we're thinking about using some of these findings to develop or tailor dissemination strategies, since they prioritize relationships of trust, dissemination strategies should include some component around establishment of relationship of trust by the researcher or an intermediary with the legislator, and also internal legislative research bureaus should be thought about when devising these dissemination strategies. And for advocates, they put a higher priority on rigorous generalizable research, including local data. Both groups ranked universities as highly reliable sources, although as many of us in the research group pointed out, some of this may be biased as they're reporting it back to academics. And advocates, in addition to information from their own organization, relied on government resources, whereas legislators rated constituent sources of information highly, which makes sense. So some of you may be familiar with Byron Powell's and his co-authors' work on the 2012 and 2016 cataloging, defining, and refining implementation strategies, and several of them, for example, tailoring strategies to address barriers and leverage for facilitators or setting up academic provider partnerships, have parallels to the policy dissemination settings. But compared to implementation strategies, much less work has been carried out for the area of dissemination strategies, and particularly in the policy field. And so this research, this audience type of policy dissemination research is important as a first step to start formulating these strategies and testing them. Amy Eiler and her co-authors analyzed the qualitative data from the advocates, and this provides interesting context for the findings that were just presented on the comparison of advocates and legislators. And so they analyzed open-ended questions about the use of research, what makes it useful when working with policymakers, and specifically barriers, successes, and recommendations. And sorry guys. Most advocates, they found, do not have formal policy training, and they learn on the job, which presents some opportunities for training. They reported that success depends on developing and maintaining a professional relationship with policymakers to facilitate the flow of information, and this, they stated, makes for a commitment that is long-term. And they said that using research that is understandable, concise, uses stories, is relevant to local actors, is credible and timely is important. So this really reflects what the legislators say they need as well.
And so just to dig in a little further about the advocates, because they are this important conduit to reaching the policymakers, we looked at what characteristics of the advocates might dictate what their preferences were in terms of getting and using information. And I just pulled out a few of the findings from another one of our papers that I thought were particularly interesting. So one of the questions we looked kind of deeply at was whether, or the frequency with which advocates reported using evidence, different sources of evidence, and we compared those based on the age of the advocate, and we found that older advocates, when we looked at younger advocates, they were less likely to do things like attend seminars where research was discussed. They were less likely to take the results of a relevant study into account when making a policy decision. They were also less likely to talk with their colleagues about research on different issues. So just in terms of targeting these audiences, where they're going to go for evidence and what sources of evidence they're going to use, thinking about the age of that advocate in that targeting process can be helpful. Similarly, we looked at some of the advocates' positions on fiscal and social issues in terms of how they perceived reliability and believability of research evidence from different sources. And so it's not surprising, but was interesting to sort of confirm what you might think, that when looking at research evidence from a government source, advocates who rated themselves as moderate on social issues rated government sources more highly than liberals, independents, others, or conservatives, which I guess puts people in the middle who rating themselves as in the middle more trusting of government sources. Things for reliability and believability based on fiscal and social positions. So fiscally independent advocates rated this source more highly than fiscally conservative advocates. That might make sense. And also socially conservative advocates rated university sources of lower reliability and believability than moderates. So just thinking about and knowing a little bit more about an advocate in sort of developing that relationship and providing that information can really help make your information either more useful or also more reliable and believable to that audience.
A couple of studies carried out by Jonathan Pirtle and Russ Brownson and their co-authors also looked at the differences by subject areas. So for the Pirtle et al. Study, they looked at legislators who prioritize behavioral health issues and whether they differ from those who do not. And they found that most are likely to use research evidence to determine their health policy priorities, and they're more often they more often attend research seminars or presentations, although in both groups, they reported using research frequently, and in both groups, they less frequently read the scientific articles and reports, and neither contacted researchers often. And also, legislators who prioritize behavioral health issues placed a higher premium on research that is unbiased, concise, and tells a story. And similar themes were found in Brownson et al., where state legislators working on cancer control and its risk factors valued scientific evidence more highly than those working on other issues. So this is important for us as researchers, for those legislators who are our first points of contact, who are working on these, and for example, physical activity. We know that they are looking to use research. And so the question is how to get it to them. And then if we wanted to target other legislators who sign off, we might need to get a policy adopted, then we might use different strategies. And finally, there was a cool paper that came out of our research team by Sarah Moreland Russell and her co-authors that examined the usefulness of legislative testimony. And this was based on a series of open-ended questions about how hearing testimony influences legislators' decisions and what characteristics of the testimony were important. And so they found that legislative testimony influences policy decisions partially. Most commonly, the result was increased awareness and, to a lesser extent, policy decision-making. And unsurprisingly, the characteristics of the presenter, such as credibility and expertise, were most influential characteristics.
So that even more kind of highlights that source as being really important. But we just wanted to talk a little bit about a model that might be helpful in organizing this conversation and putting some of the findings that we've presented in place. The citation is Brownson et al. Because it's an article that we just recently published in Journal of Public Health Management and Practice, but the framework is actually based on research from 1949 by Shannon and Weaver. So it's been around for a while, but is still relevant even when we think about all of the different channels that are available now. So we have social media, we have email, we have e-blast, we have all kinds of ways to get in touch with people, but this is still relevant. And so we just see some of the things that we've talked about today. So things about influencing different sources, like incentives for academics to engage with policymakers, because we've seen in some of these different findings we've presented how important that source is, and how among...
Oops, you guys cut out.
And also thought it was being unbiased. Sorry, was there someone trying to say something?
Oh, I just said you cut out for a second, but now we can hear you.
Can you hear us now?
Yep, we can hear you. Great.
Okay, sorry. So again, having the source be someone who is trusted and that is perceived to be unbiased. Like any kind of health communication you would be doing, similarly communicating to a policy audience or an audience of advocates, having that message be relevant, and whether that's relevant to constituents, to local data, any of those kinds of things that we've sort of presented, that importance varied by audience. So knowing that audience and knowing what is the most important, what's going to make that message most salient to them, having it be concise and easy to read, easy to digest, and we heard several times from these groups that cost data be included in that decision to be able to influence decision making. In terms of the audience, again, thinking about elected officials, there's actually a nice table if you do want to look up this paper on the different timeframes that different types of officials, either health departments, department officials, elected officials, and then staffers, the different timeframes that they're available in their office, and so then what kind of information they value based on that time frame. The attention span of these stakeholders, and not just how much they can pay attention, but how many things they have coming at them, as sort of as indicated by that Kingdon framework. The types of decision-making processes that have to happen for these different individuals and stakeholders based on their position, and then whether they're trying to be reactionary or proactive in terms of using this information, and often it might be reactive, that makes the information that they need more time sensitive to be able to deal with a specific issue at a specific time. Sorry. And so this makes it important to know and understand your audience. And, we did definitely some crude digging down into advocates by different characteristics, legislators by different characteristics, but there's a lot to understand and be able to tailor to these audiences and the position that they're in, understanding what they care about and what kind of information they need. So for example, local information that's relevant to their constituents that comes from a source that they trust. Those are going to be some of those sort of general characteristics. And then knowing where they go for information and making sure that those people or that source has the information that's evidence-based that stakeholder is seeking out.
And so we wanted to share some of the future research directions that we're coming away with from our research on these topics. And so one that we've already been talking about a little bit is increasing the intervention type of policy dissemination research. So testing, crafting and testing dissemination strategies with different actors and looking at the results. But the other part of it was the role of the advocates. So we know that what advocates perceive of what works in communicating research to policymakers matches the preferences reported by state legislators, at least in our study. And so advocates already recognize that developing and maintaining professional relationships with policymakers is essential, and it takes long-term commitment. They often act as information channels from other research, we know this, and have the ability to support evidence-based policymaking through activities not usually carried out by researchers and activities for which researchers face barriers. And they're able to routinely build coalitions around common policy issues and coordinate messaging and exchange of information. And so the researchers can and do participate in the policymaking process, as we all know. They have different comfort levels on the continuum of advocacy, and they encounter several barriers based on the institution to doing so. And partnering with advocacy organizations, we think, may address some of these barriers. And so that's one of the research priorities we have identified, is testing the effective dissemination strategies that target advocates and understanding how they can be included in putting in place evidence-based policies. And so before we end, we wanted to thank Dr. Russ Brownson for contributing slides and other inputs as we were developing this presentation, and also the people on our research studies, Beth Dodson, who actually mentioned she'll try to jump on this call, and if she's here, it'd be great if she could help answer questions, and Amy Eiler, and of course, Ross Brownson. This following slide includes selected references, but the bolded ones are the papers that we discussed just now. And our email addresses if you wanted to reach out, but we're here for questions.
Great, terrific. Thank you so much. What a informative and useful presentation. And I wanted to let everybody know, we will certainly get permission from Alex or Rachel if we can share the slides, but at least we'll have the reference list. Hopefully we can share with you guys if you're interested in more of this work. Let me now open it up for questions and comments. I know I have a few, but let me see if other folks on the phone or even through the chat box have any questions. And please remember to unmute your line if you've been on mute. Okay. Well, this is Keisha, so I'll go ahead and ask the first question. This talk is really timely. I actually talked last night to a number of doctoral students who were learning about health policy about this exact topic. And one of the students asked a question I'd love to hear your thoughts on, and it related to strategies that you have found are effective when you have policymakers who are even questioning the science at all, right? So if you're trying to disseminate evidence and you're using best practices, are there any useful strategies when the individuals you're connecting with aren't even supportive of the research that you're presenting, and wondering, how do you navigate that, particularly in this political climate where there's more and more questions about science and whether people sort of believe it's valid?
So I don't know that we have a specific answer, but just in thinking about some of what we found, that really thinking about that source and having the information come from someone that policymaker trusts could be something that could get around that idea of whether or not they believe evidence or not. They don't have to know that it's evidence, not to be sneaky, but they don't have to necessarily know it's evidence. They just have to know that someone they trust is telling them information. So something like that could be a way to get around the idea that that scientific evidence may not be something that's reliable, and that really then, and sort of we saw this in what sources advocates do report trusting. So whether a government source is trusted or a university source is trusted, those may not be the trusted sources for a lot of advocates and policymakers. And so thinking about who might be another source that could provide relevant information and trying to collaborate with that stakeholder to bring the information that you are interested in conveying to that stakeholder, and then also thinking in terms of how that message is framed, that it's maybe framed more within the policymaker's interest as opposed to focusing so much on that it's science or evidence.
Great, thank you. So there's a question. Oh, sorry, go ahead.
Well, this is Jeff Whitfield. I was just going to add, I think your slide that shows the differences between policymakers and advocates is striking, to say the least. I mean, the differences between those two groups are pretty amazing. I guess I shouldn't have been surprised, but I was, and I think I don't know, I'm not 100% sure of where I'm going with this, but it seems to me that this is something that I've been thinking a lot about lately is how to make sure the data that we as the public health scientific community are producing are actually useful to make changes in policy. And I think this slide really drives home for me that the things that are important to us, and I'm saying us kind of more aligning with the advocates, so kind of putting public health practice and researchers in the as being a more similar group perhaps to the advocates because of our common interests, but finding those non-public health data points and kind of stretching beyond our comfort zone to find data elements that resonate with this group of people that is so completely different from us. So I think that slide really just kind of punched that home for me. And yeah, that's kind of my thoughts. I don't know. I'd love to have your thoughts on that if you have any comments.
Yeah. No, I mean, that's exactly right. That's it. You have to be framing your messages to who you're speaking to. And I think kind of what you were talking about, a lot of times when we use words are terms like disseminating to policymakers, and you instead, it makes a difference in comparison to, for example, information exchange, like if we're thinking about it as an exchange, because even, the kind of research questions that we're asking, are they the ones that policymakers want answered, right? And so a lot of times, even we in the D&I area are talking more about the research information flowing from us to the policymakers, and not so much about from the policymakers to us. And of course, this is kind of touching on the long-term established relationships between researchers and policymakers. And it's interesting, yesterday we had a presentation by Russ Brownson, and there were some questions, and one of them was around incentivizing this kind of work by academics or even people involved in public health otherwise. And it's not really being incentivized in many institutions. So yeah, we could make changes even at a more root level around this to kind of get this behavior to happen.
Mm-hmm. Yeah, great. And this is Keisha. Jeff, to your question is a really great one. I want to say it was sort of my sense that there would be these differences, but to see the data empirically, it was really striking as well for some of the particular stark differences around the metrics that they looked at. So thanks for that question. There's a couple of questions on the chat box I wanted to ask. So the first one is says, do your results speak to the relative usefulness of the stories versus the data for advocates versus legislators? Any thoughts you have on that?
So there wasn't, actually, let me think. What I was going to say is that there haven't been any studies where we were testing dissemination strategies with advocates, but there were some with legislators, and I can't remember exactly the results, but I know that stories tend to resonate more. For advocates versus legislators in our study, the advocates actually reported having, and Rachel just pulled up the questionnaire, having research information that tells the story of how the health issue affects the people served by their organization, which I'll have to look at the data, but I know both groups rated that pretty highly. So in general, I would hypothesize that works. Storytelling works better than presenting data. Of course, you would want to have some local data or incorporate it into story, but there are some actually intervention trials out there.
Yeah, and they're actually, this is a totally different study, but we had a study that tested different kinds of policy briefs using stories or data, and there were differences, and now I'm not going to be able to remember which one. I apologize, I was not involved in that study, but where they compared staffers and legislators in terms of their preferences around national versus local data and stories versus numbers, and there were differences between groups. And I apologize, I can't remember which one was which, but I think it was that the legislators liked stories that were local, and the staffers liked, or I think it was a reported usefulness, the numbers that were national, but I could be wrong about that.
This is Keisha. Is that paper on the list of references, or if not, maybe I can get that as well and send that out?
Yeah,
it's not on the list, but it'll.
Yeah, if you can get that, we can send that out. Thank you.
Yes.
Thanks. Speaking of, there's a couple of other questions. One on this sort of similar issue. Somebody asked, when you're differentiating between legislators and advocates, how do you classify professional public agency staff?
I don't know that we.
Say that again.
Been thinking about it.
by professional public agency staff? Were they in your group as legislators or advocates, or were they not part of the sample?
The legislators were all elected state level legislators, so they are not part of that group. I'm just
the paper that we mentioned by Dr. Brownson, the one we just had in Journal of Public Health Management and Practice, has a nice table though that summarizes those different types of audiences, and executive branch like public health practitioners. Those are discussed and sort of explicitly talked about as an audience for policy dissemination.
Okay, great.
That's great.
Excellent. Yeah, and I'm looking at your really great table, and it also has a separate column for staff members too. So, Teresa, you asked a question. I think it'd be that might be something you want to look at. Just to go back to your question earlier about the story, and somebody asked, how do you define a story? Does it have to be a success story? If you can reflect on this other paper that you mentioned.
I think it's less of a success story and more from the perspective of a constituent. So somebody locally who is relevant to the policymaker and how a specific research issue and potential solution would affect them. Is that the sense?
Yes.
From the specific study?
Not necessarily like, X% of the population has obesity, or this constituent of yours has obesity and now she has diabetes, and she has an abscess on her foot, and these are all the negative consequences that are happening to her, would be more of the kind of story, I think, that's referring to.
And if she had access to this and this and this,
this is what
due
would help
to
her.
a specific policy, and this is how many people could be helped.
Great. So really putting that sort of human context into it. I know work I've done in the state of Maryland, the legislator I do work with is always like, is this constituent and wants to know, does this person live in my district and what's their story? So I appreciate that comment. There's another question asking about, were all the questions in your study framed as quote unquote health policy or more policy in general?
They were framed, I believe, as policy in general. When specifically it says how much of a priority, and what is the previous question? Sorry, Rachel has them open for us. When working on a policy. So generally policy, but
so like the STEM was general, but some of the individual items were specific to policy, but most of them were just general.
But it would be people who prioritize certain policy areas.
Yes, that was part of the sampling as opposed to in the questions.
Okay, great. Thank you. Other questions on the chat box? I think I covered them all. Or other questions on the phone for our speakers? Okay.
Hi, this is Amanda. I maybe have a question. We've been talking about developing policy briefs. We've got a couple working groups that are finalizing some papers that they've submitted for publication. And I wondered, a lot of times we look for examples of policy briefs, and Tom has sent us some, but do you have a go-to place that you recommend for policy brief examples and maybe even images that you use to include in your brief?
We don't, and actually, a lot of my work is actually not with elected policymakers, but with other kinds of stakeholders, and so it seems like the audience is really, really matters in terms of what those look like and what kinds of images and what kinds of different figures and things are useful to those audiences. And so I don't have, actually, we partner with someone who has a communications department, and so they're really good at being able to do that kind of thing. So I'm not sure where necessarily the best option is, but if there are, I imagine on this call, there are a lot of people who know much more about this than I do. And so I don't know if you can plop those in a chat box so that people can see them if there's one that you use.
Yeah, and also this is Keisha, if people have samples, feel free to send them to us, samples that are publicly available that we could share, or places where they go, so we can let individuals on the call, if they're interested in doing more of this work, know some good places to work or good groups to work with. Great question. We got another question pops up on the chat box. and it's about joint use policies. And somebody was asking specifically, how would you incorporate a constituent story to influence a policymaker, specifically for joint use policies? Do you have any examples from your work or any thoughts on this?
So I don't have examples from my work. This isn't necessarily a policy I've worked on, but you could imagine a story, talking about a family that maybe decided they wanted to be active, and they had a resource in their community where they were able to use like a school track or something like that, and were able to start building different habits, and the benefits that that family achieved, who happens to be a constituent, happens to be a school in that policymaker's district, something like that, that really humanizes the experience for the policymaker. I just wanted to, I found the article, so I just wanted to say what the accurate information is about those briefs, where they tested briefs that were story containing versus more statistically oriented. And the summary from that was that staffers found the story focused briefs with state level data most useful, and legislators found the data focused briefs containing state level data most useful. And I think I had completely had that backwards. So, and we'll also provide the link to that article.
Great, thank you.
And there's for just the previous question, there's a comment that just popped up.
Okay, yeah, Amanda wrote about ALRs when it's in joint use studies, so she could connect Gabriella, who had the question, with some researchers from that work. So Gabriella, if you're, I'll feel free to email me. I'll put my email address up here, or if and I can help make that connection. Okay, great. Are there any other questions for our speakers? Okay. And while we're waiting to see if anybody has a question, I'm looking through the chat box. Oh, and thanks, Amanda, for posting that research brief on joint use in the chat box. Okay. Well, I don't hear any other questions, so let me go ahead and wrap up this portion of the call and just say how thankful I am to both of you for making time today, and to everybody for being on the call. This was incredibly engaging, and we really appreciate all the knowledge you shared. And I know the resources and the references that you're going to give to us to disseminate will be widely used. So again, thank you very much. Really terrific presentation.
Thank you so much for having us.
Yeah, it was our pleasure.
Of course. So before we wrap up the call, I wanted to see if anybody has any announcements as part of open mic. If not, we'll end a couple minutes early. Let's see if anybody has any questions. We'll pause for a second.
Hi, this is Amanda. I'm reporting live from New Orleans at the National Recreation and Park Association Conference, and I just wanted to give a shout out to Jeanette Gustat, who presented some work that her and Sandy Slater and Miranda Hyde had presented at NRPA. They had a poster on a joint use on my mind now, a park prescription literature review that they're working on to submit for publication. So NRPA is a huge conference, and there's lots of interest in park prescription programs this year. There's a lot of momentum behind it, and so it was a very timely topic. And I think Jeanette had a lot of people that she talked to, and some folks from NC State that are doing work. So we made some good connections there. And also, I don't know if Teresa Pembroke is still on the line, but she also presented here at NRPA and on her dissertation work. So we might, Teresa, you're wrapping that up, so it might be a fun presentation for this group of interest as well. So if there's anyone I missed, speak up. If you were at NRPA, I just was scanning through the attendees. So if there's anyone I missed, give yourself a shout out as well.
Thanks, Amanda. This is Teresa. Can you hear me?
Yeah, we hear you, Teresa. Congratulations.
Hi, everybody. Yeah, thank you very much. Yeah, no, I'm just in final edits, and so after next month, hopefully I'll have some time to start thinking about dissemination of my own work. So I appreciate this topic today. It's been very good. Thank you.
Great. Thank you, Teresa. Okay. And thanks, Amanda, for sharing that, and congratulations to everybody who's at the meeting and presenting. I want to say again, today's topic was really in direct response to what we heard from all of you. So I encourage you to please let us know topics that you want for the future, and send them to me. I put my email address in the chat box, and for those of you on the phone, please feel free to contact me at KPOLLAC1 at jhu.edu for Johns Hopkins University. We look forward to connecting with all of you again at our next call. And I hope everybody has a great day. And for those of you at the conference with Amanda, I hope that you enjoy the rest of the conference. And again, many thanks to our speaker. And Amanda wants me to remind everybody you can hit us up on Twitter at PAPRN plus spelled out. So thank you so much, and thanks for the congrats, Christian, in the text box. All right, everyone. Have a great Thursday, and look forward to talking to you all soon. Take care.
One quick interjection.
Oh, sorry, yeah.
Yeah, just please remind people to update their presentations and papers in the spreadsheet that Amanda's developed. We want to be able to brag about your work.
Yes, great reminder. Thank you. So yeah, there is a Google Docs that a Google Sheet that we will put in the minutes. We've been keeping track of all of the PAPRN Plus related talks and presentations, and it's great to just have all of that summarized. So please send those to us. We can upload them ourselves, and it's really great to keep track of all the wonderful things going on. So again, thank you, and thanks for that reminder, Tom.
Good work, all.
Yeah. Take care, everyone.
Thank you.
Thanks.
Bye-bye.
Bye.
Thanks.
Bye, thank you.